Mute everyone. Okay, so let's start the class. So yesterday we talked about the topic skeleton. In the skeleton, we started and studied about skull. So basically, skull have uh, 8 bones in crania region and 14 bones in fascia region and 3 bones, small bones in the ear and 1 hyoid bone. Basically, cranial bones are frontal bones, parietal bone, temporal bone, ethmoid bone, and sphenoid bone. So facial bones, what are the facial bones? So we talked about facial bones also. In the facial bones, we have mandible bone. Okay, mandible, this is the lower jaw, maxilla, upper jaw, nasal bone. Okay, lacrimal bone. In the lacrimal bone, we have lacrimal gland. Okay, zygomatic bone. Okay, which is connected to the maxilla and frontal bone and temporal. Zygomatic. Palatine bone, which is hard palate and soft palate. And we have vomer, conchi, and paranasal sinus. Paranasal sinus are uh, covered with ciliated epithelium. Okay, and here are the sinuses we have. These are the ethmoid sinuses because it is the near the ethmoid region, that is called ethmoid. It is the maxillary sinuses because it is near by the maxillary region. Okay, this is the frontal sinus. This is the sphenoid sinus. Okay, so these are the frontal sinus, ethmoid sinus, sphenoid sinus. Okay, so these are the very important sinuses which maintain the weight of the skull. Okay, and as well as which give uh, airway passage, and it will increase the voice range. Okay, so these are the things which is very important we have to know. So next we have the topic called vertebral column. So friends, so we are talking about vertebral column. So let's resume the class. So vertebral column. Vertebral column is also known as spinal cord or spinal column or backbone. Is made of individual bones called vertebrae. So what are the names of the spinal cord bone? Vertebral column, that is vertebrae. Okay. So each bone have their specific names according to the area. Okay. Let's see that location. According to the location, the length of the spinal cord is divided. So basically, there are seven cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral fused into one sacrum, and 4 to 5 small coccyx vertebrae fused into one coccyx. Okay, so these are the uh, long bone called vertebral column, which is situated in the back. So here we have the image. You can see that this is the vertebral column. Okay, this is the vertebral column, whole bone. Okay, so according to the area, the bones are divided. Okay, let's see each and every division. So this is the cervical area. Cervical bones have 7 bones: 1, 2, 3, 4, 5, 6, and 7. So these are the 7 bones which are situated on the neck. So that's the reason we will call cervical. Cervical. So this area is known as cervical. How many bones are there? So 7 bones. Okay. And the second area, that is called thoracic area. In that we have 12 bones. How many bones? 12 bones. Okay, 7 plus 12, 19. Okay. Then we have lumbar area. In that area we have 5 bones. 5 bones. Okay, 24. So if we calculate each and every bone, we have sacrum 5 fused bones, coccyx 5 fused bones, so 10 bones. So we can calculate as 34 bones. Okay. So these are the vertebral column. So why do we have vertebral column? Because skull is protecting the brain and vertebral column is protecting the spinal cord. So this is the skull. In the skull we have brain and this is the spinal cord. In the vertebral column, the spinal cord is fixed and it is protected by the vertebral column. Okay. So first we will talk about cervical. Okay. The seven cervical. The seven cervical vertebrae are those within the neck. The first vertebrae is called atlas. What is the name of the first vertebrae in the cervical region? This is called atlas. What is this name? This is called atlas. You can see here. You can see that atlas. This is the atlas. This is the atlas. Next, which articulate with the occipital bone to support the skull and forms a pivot joint with the odontoid process of the axis. So atlas is attached to the axis. So axis have odontoid process. So this is like hook. This is the hook. Okay, this is the atlas. In the second, this is the second vertebral column, that is axis. So this is the atlas, and the axis is like that. You can see like that. Okay, so this is situated in between this. Okay, atlas. So you can see that in this image. So okay, so this what makes occipital bone. This is the occipital bone. Here we have the one space in that the atlas axis are fixed. Okay, first we have occipital bone. Okay, in that we have atlas. Next we have axis. In the axis we have odontoid process. Okay, we have odontoid process. So this is the odontoid process. This is the atlas. This is the axis. Let's see in another image. Occipital bone. So you can see that this is the occipital bone. Okay, this is the foramen magnum. So here the axis will attach. Axis will attach. Then an axis is attached. No? So then in this axis we have sorry, atlas is attached. Atlas is attached. This axis will able to round the neck, or you will able to freely mobilize the neck in the on the three sides: right side, left side, upside, downside. But you do not able to turn your face on the back. Okay, these have three directions only. Okay, so this is called vertebral column, cervical vertebrae. Okay, next, other five cervical vertebrae doesn't have individual names. Okay, or other are five which help the neck, which help the neck, for supportive reasons. Okay, yeah, it is also help to protect the cervical spine. Okay, so whenever damage occurs, actually most of the people have the complaints about cervical spondylitis, cervical uh, intravertebral disc damage, prolapse intravertebral disc or herniated disc. Most of the people have complaints in that area, cervical region or lumbar region. Okay. So next, uh, and other problems like cervical spondylitis. This is the most common because of uh, the movement, because of the movement, and we have the straight neck. This vertebrae is very straight, but this is curve, and another it is also curve. So whenever we sit straight, we have to like this in position, neck very straight. Then only your vertebral column is on the position. If you like sit like this, if you're watching the on the phone like this, okay, putting your head forwarded, so entire skull, entire neck weight is directly on cervical region. So that's the reason the weight cannot bear by the cervical region, so it will lost its mobility, flexibility, its power. Okay, so there's the reason we have to do exercises, next exercises, okay, to give strength these muscles, to give strength these ligaments, bones, etc. Okay, so basically, so kindly ask the patient, basically advise the patient about exercises, and advise to take low pillows, very soft pillows. Okay, okay, and keep the head always straight whenever talking, reading, okay, sleeping, okay, or watching mobile, using the mobile, or driving, anything. So which makes your spine very straight and in this position. Always in this position, the spine must be have. Okay. So this is all about cervical vertebrae. Next, we will talk about thoracic. Thoracic vertebrae with the ribs on the posterior side of the trunk, the lumbar vertebrae. So these are the thoracic vertebrae. Basically, the thoracic, it will protect the thoracic spinal cord. Okay, it will protect spinal of cervical region, spine of thoracic region. It will protect, and it will articulate. It will connect with the ribs which are coming from the forward region, front region, anterior region. Okay, so most of the people have one complaint when you see in most of the people have thoracic, in the thoracic vertebrae you can see, and the thoracic also known as dorsal. Okay, MRI dorsal region, MRI cervical region. Okay, most of the neurologists advise, if anyone have complaints like cervical pain, the patient is unable to lifting his hand, because the all the nerves which are coming from the brain, from the cervical region, it is entering into the upper limbs. So whenever cervical spondylitis occurs, the nerve compress. Okay, nerve compress occurs. Okay, so what happen if the compression is right side more, then the right nerves will compress and right hand numbness, tingling. Okay, these are the complaints the patient will tell you. If the compression is more in left side symptoms are seen. Okay, so this happen in most of the cases. So doctor advice, neurologist advise that you have to take cervical MRI to identify the problem, etc., etc. Okay, so this is the about cervical region. Next, we have thoracic region. In the thoracic region, most of the common disease you can see that dorsal TB. Dorsal TB is the most commonly seen case nowadays, because basically it is nearby the lungs. So whenever TB is came from the nose on the lungs, so basically it will enter nearby the organ. So nearby the organ is mostly it is the spine. Okay, Okay. So this is all about thoracic region. Next we have lumbar. So thoracic, excuse me. Thoracic region have 12 vertebrae. So in the cervical we have 7. Thoracic region have 12. Next we have lumbar. The largest and the strongest bone of the spine are found in the small of the back. The sacrum permits the articulation of the two hips, the sacroiliac joint. The coccyx is the remnant of the tail vertebrae, and some muscles of the perineum are annexed to it. So basically, the lumbar is the strongest bone in the vertebral column because it have to lift the weight. Everything you have to lift. It will first of all, it will give the pressure on the lumbar region. So there is a reason most of the patient have complaints lumbar disc problem, ventravertebral disc problem. Okay, most of the ladies have sciatica pain, okay, because one nerve is coming into the lower limbs, okay, which is compressed in this region L1 L2 or L3 L4 L5. This is the most common site of nerve compression. Okay, so we'll talk about in detail in the CNS. We have sacrum bones, 5 fused bones, and the coccyx bone. So okay, which will give support to the lumbar region as well as pelvic region. Okay, you can see here the whole vertebral column. You can see there. This is the, you can see, the vertebral column here. Yeah, each one vertebral column. So this is vertebral column. You can see that this is the body. This is the body. This is called vertebrae. One vertebrae. Okay, this is vertebrae. This is a disc which maintain space between two vertebrae. This is transverse process. This is transverse process. This is spinous process. This is transverse process. This is spinous process. This is a spinal nerve. This is a spinal cord. Spinal cord enters and it will leave. Okay, and we have covering of the 3 meningi. Okay, then these are the spinal nerves. You can see each vertebrae. This is spine. So you can see that spinous process. This is the spinal cord. This is the body, face, foot, head or rib. Vertebral arc. This is the transfer process. Please, you have to diagram this each one vertebrae and name as named. What is the name is given? Okay. Okay, this vertebrae is very good. Anterior region. So this is the in this foramen, vertebral foramen. In that spinal cord is going. Okay, we will talk about in detail in central nervous system about vertebral column more. All the vertebral or vertebral articulates with one another in sequence, connected by ligaments. So each vertebral column is connected with ligaments to form a flexible bone, okay, that support the trunk and head. They also form the vertebral canal, which I showed in the figure. Okay, a continuous tunnel within the bones that contain the spinal cords and protect it from mechanical injury. Okay, the spinous and transverse process are projectors or the attachment of the muscle that bend at the vertebral column. So these are the spinous process, transverse process. This is the transverse process. This is the spinous process we talked about, spinous process. Okay, muscles are attached to that processes. The faces of some vertebrae are small, flat surface for articulation with other bones. So some facets are there which will articulate each other, each bone. Okay, ribs. Okay, with thoracic vertebrae. The supporting part of the vertebrae is body. Okay, we've seen in the figure, and we've seen discs, and disc is made up of fibrous cartilage. Fibrous cartilage is cushion and absorb shock and permit some movement between vertebrae. So this make movement. Okay, cartilage make movement of the, you will bend forward, will bend backward. So why this is happening? Because of the disc. Okay, since there are so many joints in the backbone as a whole is quite flexible, so that's the reason these are the flexible. So the normal spine is anatomic position has four nature curves which are named after the vertebrae that form them. And notice the cervical curve is forward. So I told you that cervical is forwarded. It is, and the thoracic is back. This is the thoracic back. Okay, and the lumbar is forwarded. Lumbar is forwarded, forwarded, back, forwarded, and back. Main back. These curves center the skull over the rest of the body, which enables a person to more easily walk upright. So that's the reason we can easily walk. So this is the reason the curve is the curvature of the vertebrae we have to maintain by sitting in right position. Okay, so we'll continue our lecture. Kindly join. Okay, I am ending here.